a second. Perfect. All right. Everybody could see my slide, I hope. If you don't see it, please let me know. All right. I'm guessing I'm not hearing anything, so I guess everybody could see my screen. So, where is this? So today's topic is on gut wellness revolution, saying farewell to digestive distress. The basic thing is that we want to have a holistic approach to gut recovery. It's not about taking pharmaceuticals. I mean, there's place and time of taking PPIs like Protonics or Nexium for that matter, and it's been in the market for a long period of time. Now, did you know that taking those particular medications that doctors are prescribing for, let's just say acid reflux for that matter, can actually make your body sicker? The reason being is when you're taking these particular medications, end up having to deplete some of the nutrients like B vitamins, like B6, also magnesium, vitamin D, calcium, iron, right? So some of the key nutrients that you need for your body to work well, but also your cell function to work well. Well, unfortunately, taking these type of prescription medication end up having to cause more detrimental issues down the line. There are literatures and evidence showing that taking PPIs long period of time actually make your overall gut microbiome, right, your gut bacteria to get worse. Also, it decreases your absorption of nutrients I mentioned before, but also healthy fats, right, that you need. You also can result in severe bacterial-related infections in your gut as well. So it doesn't really help that much. It doesn't get to the root cause either. So that could be a big problem. And so tonight we want to really focus on the holistic approach of health, of your gut health, gut wellness revolution, that is, and saying goodbye to bloating, cramps, and runs, and etc. So congratulations, taking your time to join this amazing, amazing workshop. And so the fact that you are here tells me that you want to gain freedom from all your gut issues. For instance, you may be dealing with severe bloating, cramping, or pain every time you eat, right? You don't have a good relationship with food at all. And then second thing you end up having to deal with is that you're dealing with irritable bowel syndromes your entire life, and that's been revolving around your symptoms, basically. You're basically living inside your symptom, and it's just basically becoming a issue where you're not able to gain the health that you're looking for. And the third thing is that you tried everything, nothing seems to work, and you've taken the antibiotic that the doctor recommended you to do to really get rid of the SIBO issue. You probably have done juice cleanses, detox programs, etc. Nothing seems to work. And so the cost of it is not only that it costs money to deal with all these issues by going to doctors, getting tested, all that, but also the cost of your quality of your life also gets affected as well. For instance, there's an unpredictable but also embarrassing symptoms you're dealing with. It's just gas, bloating, odor, right? Very unpleasant experience you're dealing with. Also sometimes consistent visit to the ER because you have this lingering heartburn, the achiness, right? You're feeling very fatigued. That could be another issue. So 3 million hospital admissions because of GI issues. And if you look at the total dollar amount, staggering amount of money being spent on GI conditions compared to others such as mental health. So GI is a bigger issue that's not being talked about. And the issue is that a lot of people end up having to just live with it. They end up living with the actual problem with gut and think that that's normal, right? Having to deal with bloating issue after eating something, that is not normal, right? There's an underlying issue with your gut that you're not able to absorb some of the nutrients properly. Also, there could be a missing days of work and activities followed by missing going out to social events with your friends because you have GI issues. Also, you might be labeled as that person who's dealing with the GI problem all the time, right? So who is this workshop not for? Well, you're not dealing with any gut issues, then this is not a place for you. But a lot of you are here because you want to invest in your total health approach in terms of taking care of your gut. So I want to make a big promise with you that today I'm sharing with you what is possible if you remove the barrier that prevents you from achieving the freedom and as well as the relief you are looking for in your gut issues here. And if you stay until the very end, that is, if you still stick with the very end, I'm going to give you some of the top-notch information that a lot of people are not talking about, especially cellular issue dealing with gut inflammation. But also, I'm going to give you free gift at the end, the foundational protocol. I only give it to my clients that I work with. But also at the end, I'm also going to give you a heavily discounted one-on-one consultation and as well valuable free offers that's going to be really worthwhile for everybody to partake in. So who am I? My name is Dr. John Kim. I've been a functional medicine pharmacist for the last literally 15 years, actually. And I've been, sorry, I'm just losing my time right now, 16 years, excuse me. And one of the things that I end up having to do is that I end up having to do further training in functional medicine. And a lot of pharmacists are not into this part. If you're not familiar with functional medicine deals with the root cause issue dealing with your disease state. So we're not just giving you medication. We end up having to work with you to look at what's causing the disease and helping you to resolve that issue. And my overall thing for the last 16 years, right? Even longer than that, because I've been into holistic health for a while, especially growing up with my grandparents who were very holistic and teaching me about the little tidbits in terms of dealing with natural health, that is. I manage a lot of patients dealing with complex issues, such as Lyme, autoimmune disease, hormonal dysregulation, but also today's topic is GI issues. And so my overall mission is to empower you to be your own doctor, because doctor of the future is you, right? And the credibility is that I've been doing this for 16 years, work with a lot of patients, and my overall goal, but also my talent is to connecting patients with the overall root cause issue that's causing multiple problems, especially the cell membrane relationship. There's a cellular aspect of your issue. Your issue dealing with gut didn't happen overnight. There's a reason why you actually have that. There's a reason why you can't get rid of it is because there's a deeper cellular issue that's not being readily discussed about. Well, I am one of the talent in doing these things is that how to really pinpoint and looking at complex labs as well and teaching you and showing you where the issues are. And testimony wise, I've worked with multiple patients dealing with these things, and this is the most recent patient I've been working with right now, and she's dealing with IBS for entire life, and with some of the key changes that we have made for her dietary aspect of it, but mainly her issue was mental health, stress issues, right? Vagal nerve response that was affecting her gut and her digestion, and the IBS issue has been improving drastically since I started working with her. So before I go through my information, I want to at least share with you, some of that's joined tonight is my patients that's been working with me for the last 11 years. So a lot of you probably don't know my overall story, but some of you may. If you follow me on Instagram, I probably share with you my overall personal health journey and why I got into this field. So back in 2015, when I was young, in my young 30s, my health actually turned into a worse. So what happened was this particular two pictures is only 4-day difference. One day I was at my friend's wedding in LA, and then 4 days later I ended up in a cardiac ICU unit in Morristown, New Jersey. So what happened was that June of 2015, I was dealing with this severe heartburn. I thought it was heartburn the whole time, right? Because I always had gut problem, always. And that particular pain was keep on radiating down my chest. And then overnight, that pain radiated down to my left arm. woke up middle of the night. I'm like, what the heck's going on? And instead of going to the ER like an idiot, I just stayed home, went back to sleep, and then I still went to work because I had to work, right? And so I get to work, the pain is still not being resolved, right? I took some antacid, nothing's happening. And so I end up having to go to the urgent care center instead of going to the ER. You see how stubborn I am? So I went to the urgent care center and they did an AKG and they found out that I was dealing with unstable angina and I was admitted to the ER. And the clinical presentation, I did not have any classical heart attack symptoms, right? I was not dealing with shortness of breath or sweating. I was just complaining of this particular chest pain that was just radiating down to my left arm. And when they did the last, my troponin level was less than one, meaning that I had absolutely zero heart muscle damage from the heart attack issue. So my consulting cardiologist looked at me. He was like, you know what? You're dealing with pericarditis, which is a inflammation within the lining of your heart muscle. And when they did the echocardiogram, they found out that my left ventricle, my lower left ventricle, lower portion of the heart was not pumping correctly, which is showing that there's some kind of ischemia. So there's not enough oxygenation. And there's shown that 85% blockage of my left interior descending artery. So what that means is that there's a widowmaker, and a lot of people end up having to die when that's completely occluded. Well, at age of 33 years old, I had an 85% blockage. So I had no choice but to get a cath done. So I ended up getting a stent placed in when I was 33 years old. And I was still dealing with, at that point in time, getting out of getting out of cath lab and then going into the cardiac ICU unit. I was still dealing with this lingering pain of the chest discomfort I was dealing with. And I stayed there for 3 days. And then when I got home, the major questions that came up to me: how did this happen? I thought I was having a healthy life. I thought I was eating well, right? I thought I was taking care of myself well, knowing what I knew, but I wasn't, right? Something had to occur to cause this problem. So I end up having to meet with my integrative physician that I know. And she looked at me. She's like, you know what, John, I think you're dealing with some kind of an infection that's causing this heart attack to occur and all the problem that you're dealing with. So I was like, there's no way. So we got blood samples taken, and then we're waiting. But my visit to the hospital didn't end there. I ended up going back into the hospital because I was over medicated. And so that was another challenge I had to deal with. And then August of 2015, that's when they found out that I was dealing with positive Bartonella infection, which is a tick-borne related illness, followed by mycoplasma, which is another tick-borne illness there, right? Tick bite. I was in Boy Scouts all my life until then, and I probably somehow got tick bite and getting this particular disease. But the biggest issue is that I was also dealing with mold toxicity, right? So I lived in a very moldy house growing up. And then I had elevated viral infections that was completely hidden, and I didn't know about this. So there was a diagnosis was that undiagnosed hidden stealth infections and mold toxins may have contributed to my cardiac presentation. But the thing is, I did all the therapies afterwards. I ended up having to use some of the top-notch protocols using liposomal phospholipids. So there's a product called Body Bio that I end up having to recommend a lot. Matter of fact, this weekend there's a buy one get one free sale going on with Body Bio, and that's one of the key things I recommend for cellular inflammation and gut health. Well, we'll talk about that later more and more, but that's something that I did to recover my cellular inflammation and the gut issue that I was dealing with. Also, the heart attack, right? And utilizing some of the powerful herbals to deal with the biotoxin, the infections I was dealing with. Also, there's a key component called biofilm. So biofilm is a protective layer that bacteria grow to protect themselves from antimicrobials and other matters, especially immune system. So these infections are very stealthy. You can't catch them that well. And then some of the labs that are being used right now by the doctors are not very sensitive enough to take care of it or to detect it for that matter. And that's the thing. And so not even just that, I end up having to really do an overhaul on my stomach barrier and the cell function I was dealing with, and preventing further biotoxins from adhering to my cellular function, especially the DNA. And we're going to go over that more and more. And I mentioned about the gut inflammation is equate to cellular inflammation, and we're going to go into that particular topic. And so after 2 years, I am now cleared of this infections, right? My doctor did a phenomenal job, and I also did my own research and doing these things to get rid of the infection. And I've been very healthy. And I'll show you the 9-day difference in terms of even my skin looking different. But one thing that I learned is that I now actually have a better freedom eating food, right? What is the number one issue that a lot of people deal with? Gut issue. I'm reacting to all the things. I eat this, Dr. Kim, and I'm getting bloated. I eat this, I'm getting heartburn. I was that person. Anytime I end up having to eat meat, right, red meat especially, I was getting heartburn all the time. And so in many cases, I didn't eat red meat for 1 full year. And then also, one thing that I achieved really well myself is that I have a better immune balancing that went on. So, especially dealing with COVID infections last year, having to deal with that twice, I went through it very, very easily, right? That's showing that there's a cellular health being achieved. And as well as having a better mental health and freedom again. I was dealing with anxiety issue all the time. Why? Because my gut wasn't feeling well. And I was really having to have this veil in front of my eyes, thinking that I didn't have any issues. Well, there was problems. There was a lot of clues that Dr. John was dealing with a lot of problems, but I was ignoring it. And also found a new motivation to empower people. And that's the reason why I'm having this webinar. That's the reason why I'm very active on Instagram and teaching people as well. So the hidden issues, like I mentioned before, the hidden issue that I was dealing with is that I was dealing with bad breath, right? If you smell me in the morning, oh God, I was bad, really bad. What's that means? That means that there's a constant issue with gut dysbiosis, but also huge issue with yeast overgrowth and also lack of stomach acid that was happening in my gut. And I completely ignored it. Even though I'm a trained professional looking at these things, I ignore my own problem. Okay. Second, as I was dealing with bloating after eating meat, high fiber meals, constipated all the time, right? Sometimes I end up having to take milk of magnesia to relieve myself, right? That's not normal. Having to do with constipation and not going to the bathroom every single day, that's not normal, right? Also heartburn that I was dealing with. That's the reason why, even though I was dealing with a severe heartburn at that point in time, even though it's a heart attack, I'm like, hey, it's just a heartburn, right? This is just severe heartburn. No, there was a lot more bigger problem dealing with it. And third is that I had severe acne issues all over my back, all over my face. Okay. Anxiety off the roof, insomnia as well. I could never get a good night's sleep. And so all of these things disappeared once I ended up having to get to the root cause of the issue and deal with the cellular inflammation. And another thing is that when you deal with bad breath, right, especially having to do with bad gut function, not only does it end up having to affect the gut, but also it causes microinflammation in the body, resulting in what? Affecting your cardiovascular function. So if you have a hidden issue, if you keep on having to ignore the bigger problem, it's like ignoring the big elephant in the room, you're not going to be able to achieve the overall health and the freedom that you're looking for. So what I learned from my overall health journey is that complete healing is possible as long as you address the issue. Especially mold was a big problem for me. Mold can cause severe gut problem, okay? And Bartonella infection that could also affect the gut health as well. But I also used a lot of antibiotic. Why? Because of acne problem, because of the past history dealing with cold and things like that. And being a pharmacist, I could easily grab that antibiotic. And I thought that was one of the things that I need to do all the time. And that caused a lot of problems. Second is that proper testing is a must, right? So you need to use functional labs, which I will go over later. And clinical assessment is key. And lastly is that you need to support the cell membrane health and integrity, right? Cell health is very important. So 6 month wise, before and after, right? This is me who was dealing with severe cystic acne. You see all that scar on my face. And after 6 months, not a day difference in terms of my skin, right? Even if you meet me at my pharmacy these days, I have a very clean skin. Why? The underlying issue with inflammation, the gut problem that I was dealing with, especially the cardiovascular inflammation that I was also dealing with, has been resolved. That's the reason why. So you also can achieve this particular result as long as you get to the root cause. And that's something that I'm able to help, or some other practitioners who are trained in doing these things. So gaining health freedom is what you should be looking to, right? So you might be thinking, right? This is the most impactful part, and a lot of people end up having to get stuck in. You might be thinking that complete healing is not possible without using complicated pharmaceutical drugs, right? I didn't use any pharmaceutical drugs to take care of my gut health, right? Second is I have come to the terms of accepting my issues. If you think that bloating is normal, that ain't normal. If you think heartburn and taking antacid medication on a daily basis, that ain't normal either, right? And third is that I went to several specialists and they all say the same thing. Well, I'm here to say that they're wrong too, right? And the fourth is I don't have the time to even take care of my issues, right? And I'm going to just live with it, or I'm going to just miss the opportunity in a healthy living that I could achieve. That's wrong too, right? You shouldn't be living to accepting the problem you're dealing with, right? If you have an issue, you face it and you try to get rid of that issue, right? And lastly, I don't have the motivation to fix my issues, right? It's like the normal thing that a lot of victim mentality comes through. Well, I had this problem right now. I think I'm going to live with it. Well, you shouldn't, right? That's the reason why you're here. That's the reason why you're here, to gain your health freedom. So 3 keys to succeed, right? Is you could apply this to any part of your life. Number one, you need to be coachable. And you have to willing to take the action as well. If you're not committed to do this, it's not going to be happening at all. And also coachable. If you work with different practitioners, and if you think that this is the way that I need to take care of it, and not having the open mind, you're not going to fix that issue either, right? So that's why you're here. You're open-minded. You have an open heart to receive, right? Having the right intention to receive is so important. Number two is that you must focus on the progress. That 1% progress. I don't know if you heard of a book called Atomic Habits. I'm reading that right now. And that particular book is not only a self-help book, but it's also a healing book, right? We have to understand that we have to focus on the progress, not the results. Results going to get there. The progress, the 1% improvement in the progress I'm making every single day is going toward what I'm trying to achieve. That's important. And number three is that you must commit to never let self-doubt to stop you from what you want, right? If you keep on having to self-doubt that, oh, you know what? Is it going to happen? Is Dr. Kim's information, is that going to be really thing that's going to change my life? If you keep on having that doubt, it's not going to help you. Okay. So after going through my own health journey, just because a conventional medicine does not recognize your pain and struggle, alternative way of using real root cause medicine gave my life back, right? And it's going to give your life back as well. So you can do this, right? I went through it, my own health journey. I was scared, especially during that time. I mean, I couldn't work. I mean, I was dealing with treatment at that point in time. I was so fatigued and tired, body ache all the time. I couldn't work. In many cases, I was staying home, laying in bed, and I had to hire somebody to take care of the pharmacy. And that impacted my financial aspect of it, right? And having to spend all that money to deal with the infections I was dealing with, those weren't covered through insurance. I know what patients go through. I've been there, right? And also self-doubt. Am I going to get better? Right? Missed opportunities. Almost a year and a half, basically. I didn't leave my house, right? I just didn't have the energy to do anything, right? So I missed a lot of opportunities to hang out with friends and family. And one solid thing is that I trust the process and knew it was part of my season to reflect and be well. And that's the reason why I end up having to be here. That's the reason why I put the time in to learn more advanced medicine to help the clients that I'm helping now, right? So one of the things is that I'm going to show you is the gut freedom and the resiliency program. What is that? One, my overall program is to create resiliency in gut health to help you gain freedom from all symptoms having reactions to food, but also I want you to achieve a enjoyable life. Second, from deep down, we want to find the root cause of your issue, right? And eliminate it. And lastly, this short presentation will give you the roadmap to a healthy gut. So I have a more of a biblical approach on this. I'm a born-again Christian. The biblically centered health coaching that I provide is that, this is one of my favorite texts in the New Testament, book of Romans, chapter 5, verse 15, is that more than that, we rejoice in suffering, knowing that suffering produces endurance, and endurance produces character, and character produces hope, and hope does not put us to shame because God's love had poured in our hearts. So let's remember why you're here, right? Kind of recapping in terms of why you're here. You learned about my story. You see my journey on what I've gone through, right? The reason that you're here is to learn, but specifically, you're dealing with some kind of a bloating issue after eating certain food, right? You're constantly having the runs and can't seem to control your symptoms without medication, that is. And third is that you're sick and tired of not able to find the right doctor to address the symptoms. Next, you're accepting the problem and living with it doesn't seem fair. Why is it that, that person next to me is able to be very healthy, but I'm just having to deal with this problem and having to live with it, right? That's the mentality of a lot of people who deal with chronic illness. I get that. I've been there. And you are tired of explaining to people that you have gut problem. That should not be the focal point of your discussion, right? But sometimes it does, right? Because you're constantly dealing with this problem with gut problem you have. And lastly is that you're constantly suffering from GERD, and relying on a prescription medication like PPIs, like Nexium, omeprazole, right, are causing your conditions to get worse. I mentioned about how antacid, acid-reducing drugs, causes more problem in your gut down the line, right? So you should not be relying on these medications long term. So the first discovery that I made within this all aspect into the gut health is that there's a major impact in dealing with what? Gut microbiome imbalance. So your gut, especially talk about microbiome, right? If you don't know what microbiome is, our body is filled with bacteria that is supposed to be living inside us to help us live in this environment synergistically, right? And so our microbiome is as much as our cells, and they play a vital role in terms of helping us, protect our body from the environment, especially the mucosa, right? Our mouth in assisting digestion. Our lung is able to be lubricated from the actual bacteria, right? Stomach to help us digest. But look at this, a lot of the impact, which is called the epigenetic, right? There's genetic, but there's definitely lifestyle changes, the environment end up having to impact your overall health. And that's dealing with genetic, environment, diet, lifestyle, hormones, and industry, right? There's so many pollutants around in our area, especially New Jersey, New York area. There's many chemicals, especially heavy metals all around. And that's the thing. All that can actually impact the microbiome imbalance of years of antibiotic use is another thing, right? Biofilms. Biofilms are these protective layers that the bacteria and even yeast end up having to produce around them to protect it from other harms, especially our immune system going after them, as well as some of the antimicrobial agents that could end up having to kill off. So it's a strong mechanism, protective mechanism that the bacteria or the pathogens produce. Also, depending on how you were delivered, right? As a baby, if you were delivered vaginally or C-section, could also impact your gut health and as well as how your microbiome end up having to be produced, right? If you're also breastfed babies have less of an issue dealing with allergies. Why? Because the breast milk end up having to fortify the entire body with the healing microbiome from the mother to the baby, and that's going to help to mature the immune system, and those babies end up having to be healthier than the population that has not been breastfed. As well as food. If you're constantly eating processed food, right, that's not going to help your gut function either. Processed food, and especially when you look at a food label and see that there are certain things that you don't know how to even say or even spell, that's not real, right? That's just processed food that's going to impact your gut microbiome, but also you need these nutrients like prebiotic and postbiotic to help fortify these bacteria to thrive. And that's the problem. That's probably another reason why you cannot absorb food. That's probably another reason why you're dealing with bloating issue, right? And that causes inflammation. Discovery number 2 I'm going to share with you is that not only the gut being impacted, but the cellular aspect of it is one of the key things I'm going to recommend you seeing. What does that mean? Well, there's something called mitochondria. Mitochondria end up having to produce energy in your body. Well, when you're dealing with these type of oxidative stress, inflammation, right? Use of pharmaceutical drugs, all that can actually impact how well your cell is going to function. And so there's a term called mitochondrial dysfunction. And then this is something that I always see and consult my patients about. And these are all related to exposed to toxins, pathogens, right? And cell membrane health being compromised. If your cell function or the cell barrier is breaking down because of toxins and pathogens, use of antibiotic, use of pharmaceutical drugs, right? All those things can impact your cellular function. And if your cellular function is in a really bad burden, that's going to affect how well you're going to be dealing with your gut health. And that's something that we always end up having to miss. Why? Because the pharmaceutical company, I'm going to tell you right now, I'm a pharmacist. I'm telling you right now that pharmaceutical companies do not want you to know this. Why? Because they want you to take medication on a daily basis. That's what their business is, right? I'm here to tell you we need to look at much more differently, right? We want to look at different approach in cellular health and gut health in how to recover your body holistically. And number 3 is that you need to have a customized approach to work that's going to work for you. And that's where the genius part of working with a trained professional in doing these things, holistic approach and gut approach, right? Right. You may end up having to start very slowly, and it may end up having to be very tough to get up to that level in terms of changing your diet, changing your mindset, doing vagal nerve response work, doing breath work, eating the right food, right? Taking the right supplements, exercising, going for the walk. All those things are one of the things that I end up having to be setting that I have for my clients as a foundational protocol. But that's going to really make the dial, move the needle up and down is based on your work, and that's the 1% approach of improving, and that's where you end up having to succeed. Right? So it's not about the 7-day gut reset program that a lot of people end up to sell. It's not about some juice cleanse, right? It's not some thing that's being sold all the time. It's like, hey, you take one of these and it's going to fix your gut. No, you need to have a right approach in building the right resiliency in the body, and you are able to withstand any challenges that's going to be impacting your gut function. So another bonus discovery, right? Bonus discovery, we're like the Humpty Dumpty of all things. Humpty Dumpty, as long as Humpty Dumpty is sitting on a wall like this and nothing's impacting him, but let's just say something pushes him over, right? Something pushes him over, like a stress response or a pathogen, maybe he got sick, right? That's going to overall tip Humpty Dumpty over, and Humpty Dumpty breaks his shell. That's exactly how our body is, right? If you're not living a healthy lifestyle, we're basically walking on the edge, right? If you're having to eat processed food all the time and complaining about gut issues, that's basically walking on the edge. If you are dealing with stress, if you don't know how to manage your stress response correctly, right, you're basically walking on the edge. That's going to impact your gut microbiome and your gut function, right? If you're eating non-organic food and having to eat food that's laced with pesticides like glyphosates, that's going to also basically making you walking on the edge, and matter of time, that's going to really tip you over and chipping away on your health. And now you're dealing with chronic illness. And this is an impactful part that a lot of us are not taught, right? And I'm here to share with you that these are things that I never to learn much more deeply after dealing with my overall health journey. So, discovery number one, this is the things that I'm going to really, give you some of the pearls that I learned within my 16 years of my clinical experience. So let's talk about GERD, for instance. So patients dealing with GERD, GERD is a gastroesophageal reflux disease, very severe, right? And patients dealing with GERD can seem to control their symptoms of burning of esophagus and throat, right? Constantly dealing with pain issues, right? Burning sensation, even regular medication of taking acid reducing drugs may end up having to not work with them. So symptoms of acid reflux or burning after you eat is a constant challenge that they're facing. Also, constantly belching, food triggers of discomfort in your gut, also constantly reacting to food, and also dealing with this thing called sour stomach, right? It's never right when you're eating something. So GERD-wise, there's a false understanding that I need to take away acidic food. Food is not the main issue, it's the gut barrier that's been damaged, right? Also, as long as I take my medications, we'll have to relieve the issue. Well, it may, but I told you about how long-term approach is not going to fix the problem at all. And third is that I just need to take some acid reducing drugs after a meal to control the issue. You're not doing anything except for putting a band-aid on the problem. So the actual triggers or the cause are these. You may not have enough enzymes produced in your gut. Stress response can cause that as well. And that can cause you to not to be able to break down or digest your food correctly. So digestive enzyme, taking digestive enzymes on a daily basis is key. Each meal, you should have some digestive enzymes. That's a pearl that I'm going to share with you. Number two is stress response can actually cause slowing of your gut function. Right? Poor transit time. If your stomach is slowing down, you're not digesting your food well, and that may end up having to cause a lot of reflux, right? Maybe you're just eating too quickly, right? That's the issue with a lot of Americans. We eat too quick. We eat too much, and we eat too quick. And that could also cause GERD. Gut dysbiosis. If you have a poor gut bacteria, that's going to also impact that. Also, certain food like gluten, casein that's come from milk, yeasty food can also slow down your gut as well. And toxins, if you're constantly drinking alcohol every single day, not socially, but every single day, you have a cup of wine, for instance, medications like morphine, pathogens like yeast or parasites can cause reactions to food, right? And morphine, if you're taking a lot of pain medications, that could also impact your gut motility and cause constipation, but namely can also cause GERD, a nutritional deficiency as well, especially magnesium and zinc. And medications can reduce your magnesium and zinc in the body. So, other things, statistic-wise, there's a profound statistic of 18 to 28% of North Americans actually suffer from GERD issue. That's a lot of people. That's a lot of people, right? It's not just about the cholesterol and the cardiovascular problem. A lot of people have gut problem, right? This gut issue can actually, GERD, actually, it can increase based on multiple factors, like if you're older person, if you're men, if you're dealing with race, so especially when you're dealing with African Americans, even Latinos end up having to deal with a lot of gut issues, intaking of analgesics, so pain medications, consumption of a certain type of food and drinks, decrease the prevalence of. So H. pylori is a major infection that can cause GERD issue as well. Smoking, family history of GERD, high body mass index. If you're overweight, that could also impact that. If you're not working out, that's also going to impact that as well. So these are some of the things that's been shown by this doctor named Dr. Yamasaki et al. This is published back in 2018. But what are we taking right now for GERD? The prescription drugs. Is the prescription drugs going to be impacting this? No. Then why are we still pushing that medication? Right? This is the reason why I'm like, I hate being a pharmacist. Why? Because I'm just causing more problem at this issue. Right? And like 55 million Americans are taking PPIs. That's the acid reducing drug. And if you're taking these drugs, right, omeprazole, pantoprazole, all those acid reducing drugs, you're causing a thing called drug induced nutrition depletion. You can be low in vitamin D, magnesium, manganese, iron, calcium, you name it, you're low on it. Right? That's going to impact your cellular function. It's going to also impact your bone health. It's going to cause more issue dealing with GERD. Why? Because if you're low in zinc, you are not able to create a good, healthy gut barrier, never alone end up having to produce proper enzymes to help you digest. So what you're doing, you're basically living a cycle of problem after problem by taking these drugs. You're not fixing anything. You're causing more problem. And long-term issues, long-term use of this medication can result in low iron, anemia, osteoporosis, also perfect environment for your H. pylori to grow, your gut bacteria that's going to cause a burning matter into your stomach, and that could be very fatal, as well as poor enzyme production, esophageal cancer as well, right? Because of poor gut status. So one of the cases I'm going to show you right now is case for CJ. CJ is a 57-year-old female patient. She complains of GERD, and there's a case that I worked on, and she has severe heartburn from food, work, stress is causing more problems. So food is one thing. After going to work, now she has more heartburn issues, right? Because of stress, and can't seem to get a relief from taking over-the-counter Nexium. And Nexium or any PPIs recommended should only be taken for 14 days. Did you know that? But why are people having to take this chronically every single day? You shouldn't be taking PPIs every single day. The reason why is only recommended for 14 days, because the impact that it can make on your body. Also, PPIs only cover up the symptoms and no longer is helping her, right? She knows that. She's taking this, but she knows that she's not able to get all the complete symptom relief that she's looking for. So, so there's a little typo here. So CJ wise, what do? We end up having to assess her diet. We end up having to assess her stress response, is work related as well. We did full medical history, and then we found out she also took birth control pills back in the day. And birth control pills can also affect your gut bacteria, but also decreases acid production in your gut to help digest food. So there's a lot of multiple moving pieces here. But one of the things that she was complaining of was that she was dealing with bad breath and foul smelling bowel, right? Sign of a gut dysbiosis and yeast overgrowth. Huge issue here. So I coached her on elimination diet. We got rid of gluten, casein, corn, anything yeasty wise. I also got rid of oxalates as well. Oxalates are like kale, spinach. Those are very hard to digest. So if you're having gut problem, especially, you want to get rid of salad. Yeah, I know. It's like, what? Yeah, you need to get rid of salad for a short period of time. Very short period of time. Why? You're trying to decrease inflammation in your gut and allow your gut to at least get some rest. And you should end up having to have higher amounts of protein and some of the digestive enzymes and protocols to help you digest. So what I did was I recommended ultramolecular digestive enzymes, DGL, and Glutashield. If you're on my email list, what I did was I shared heartburn protocol yesterday, actually, and this is exactly what I've been sharing with my clients. So dealing with this particular issue, I also recommended her to take a gut bacterial testing. So basically, it's stool sampling testing, and the test is called Gut Zoomer. And after about 4 weeks, we got our test results back and saw that there's a major growth of beta glucuronidase. This actually causes overgrowth of negative gram-negative bacteria and yeast. Also, there was a low production of butyric acid. Butyric acid is very important to help create good, strong gut barrier, helps to absorb some of the nutrients, prevents DNA damage from the gut bacteria and the pathogens you're dealing with. So it's a very protective mechanism that your body produces on its own. Issue is that when you have a poor gut function, the butyric acid portion becomes poor. So what I recommend people to do is take something called sodium butyrate from Body Bio. And that could be something that you could take as well. We also found out that she had a high levels of fecal zonulin level, means that she had a leaky gut issue going on. Leaky gut equates to reactions to food constantly, having to have a higher risk of developing autoimmune disease, cardiovascular issues, and etc. So the root cause treatment for CJ, what we did was with a simple GERD issue being shown, but there's a deeper rooted problem. So what we did was we took some light, gentle binders. Binders end up having to bind to toxins, endotoxins, especially from the bacteria. It grabs onto bacteria and yeast, and is able to you're able to release the toxins and leave that. We also added some antimicrobial agents. We did herbal. We didn't do anything antibiotic wise. We did antimicrobial herbal agents to kill off the bad pathogens. Also, we allow the gut to be repaired and also replace the gut bacteria that was missing, and that actually helped a lot of issues. And that's and this is the ongoing matter. You have to be very thoughtful in terms of what you're dealing with, how you end up having to react to food, and an ongoing process. But CJ is doing much better. She's off of her PPIs, right? So that's one impactful thing that I did for her. Second, I'm going to talk about is small intestinal bacterial overgrowth, or SIBO. A lot of people actually deal with this. So according to Mayo Clinic, SIBO occurs when there's an abnormal increase in overall bacterial population in the small intestine, and particular type of bacteria not commonly found in part of the digestive tract. So where's this bacteria coming from, right? That could be a huge problem. So symptoms of SIBO deals with lack of appetite, nausea, uncomfortable feeling of fullness, unintentional weight loss, abdominal pain, bloating, diarrhea, malnourishment is a big one. And SIBO, what does stool, right? Stool of a SIBO patient look like and smell like? They can't absorb fat that well, right? So there's a foul smell of number two, basically, right? Why is that? Because when you have SIBO, the bile acid responsible for breaking down and absorbing fat, that's deficient, right? That's where the overall smelliness of the stool comes in, result in a pale color stool that is also bulky and horrible smelling, right? So you need to take something called TUDCA, TUDCA, TUDCA. That's from Body Bio as well. I do recommend that for a lot of my SIBO patients. I also recommend adding in ox bile, right? Ox bile it could be a good recommendation to add into patients with SIBO. Why? Because you need bile, right? You need bile acid to help break down fat. Well, SIBO patients cannot do that very well. So case for NC is a 35-year-old female patient, comes with severe symptoms dealing with fatigue, right side pain. Patient had done a course of antibiotic a few years ago to eliminate the H. pylori infection. So she has an infection dealing with H. pylori back in the day, but it seems like that was not eradicated that well. She also used antibiotic after her dental treatment, post-operative care, but she said that caused more problem dealing with her stomach issue. So symptoms that she was dealing with: bloating, feeling full, having trouble going, fatigue, headache, also painful menstruation. right? So one thing I suspected was that based on all these history, I suspected that this was SIBO. So one thing I started on Autospore IG, which is a particular spore-based probiotic to help decrease the SIBO issue. And SIBO patients cannot take regular probiotics. They overreact, they get diarrhea, they get sick. They need to get a spore-based probiotic, and that's what I did. I also added in SPI Protect. This is a immunoglobulin supplements that you could end up having to take, and they bind to these bad bacteria, which is causing SIBO symptoms. We also added an intestinal. Intestinal helps with breaking down biofilms. And we also added in Candida Forte because it seemed like, based on her symptoms, she had yeast overgrowth. Yeast can actually impact her menstruation cycle. So I basically added in multiple things at this point in time to tackle the problem. And SIBO-specific elimination diet as well. We took out the legumes. We took out soy. We took out corn. We also took out oxalate that I mentioned before. So we did stool sampling, right? No surprise. Very complex case. So we want to look at what's really happening in the gut. So we ordered stool sampling testing, and we found out that she had high levels of lactoferrin. Means that she has some kind of parasitic infection, right? She also had increase in beta deficit, showing that there's an innate immune response, constant inflammation that was causing the symptoms to occur. Also, another sign of MP9, which is showing an inflammation. We also show that she had high levels of eosinophils. Another sign dealing with parasites, right? Meat fiber. Why? Because she's not able to break down food that well, all right? And then she also had lack of butyric acid. So for this patient, is it smart to give just antibiotic and eliminate everything when you're dealing with parasitic issues? Right? It's not smart to do that. You also have to focus on parasitic problem. Parasites are known problem that a lot of regular doctors, right, are not able to see because they have never been trained to look at these things. So protocol-wise, this is exactly what I did for her. We end up having to work on her stress response first, right? Hard coherent breathing technique. We did a lot of vagal nerve response. We did a lot of breath work. 5 to 10 minutes twice a day is what I gave her, including 15 minutes once a week, right? The longer you're able to do breath work, longer you're able to control your stress response, the better your gut health is. We also modified her diet plan to address SIBO. We also added an anti-parasitic protocol. We had continuous using this set of supplements we started, like the SPI Protect, Autospore, and Third Biotic, which is another commensal bacteria to help to produce butyric acid. We added on there. We also added N-acetylcysteine, turmeric, phospholipids, so body bio PC, and balance oil is what I add in. Also sodium butyrate, right? Butyric acid was very low. We added on this to help with these things. We also stopped intestinal. That's the one that helps to break down that biofilms, but she was having so much burping issue from taking this, so we took it out, and we added something called prolytic enzymes to deal with these biofilm problem. Patient is still going through the 4 month of it. She's gone through 4 months of the protocol. She's feeling much, much better. But you know what? Certainly can actually trigger the symptoms, right? That's the reason it's a constant work they got to take care of. So impact of the result for CJ, less bloating, improve energy, less reactions to food, and able to go to the bathroom regularly. She was dealing with constipation. Certain days she couldn't, certain week actually, she couldn't go for a week. So if you could make a humongous impact and change of that, huge, huge for clients. And patient does realize that is a continuous work. So you learned a lot about from tonight's talk, right? So basic conclusion is that we won't be able to see the fruit of our labor until we are actually at the top, right? We are all